Hello, Protrusive, I'm Jazz Glati, and welcome to this, what can I say, it's an awesome episode. Oh my God, VFan will blow your mind. This is such a real world topic. There are so many communication gems shared in this episode. And really, when it comes to communication skills, when do they really matter? I mean, yes, it's good to get case acceptance and building value through use of communication, but when it really matters is those tough patients, those confrontations, those arguments that you might have with patients. You know, the ones where your heart is racing? Words can really be powerful, and I think communication skills are really tested in those tough scenarios, and we're talking all about those in this episode. When it comes to the word difficult in difficult patients, I was really debating whether to use it or not, because really, difficult patients are just difficult people, and you get difficult people in every walk of life. Like, if you take an arbitrary figure like 1 in 20 people, well, I don't want to use the A word, so 1 in 20 people are not nice people, right? And so 1 in 20 teachers will be not nice, 1 in 20 doctors will be not nice, 1 in 20 dentists will be not nice, for example, right? So 1 in 20 of all your patients may not be the nicest people in the world, and so to deal with these patients, it can be tough, and these patients, we class them as maybe difficult. But the funny thing about classing patients as difficult is that what you might perceive as a difficult patient, your colleague, your associate may find that they get along with the patient really well, and they think, yeah, what do you mean? Mrs. Smith is completely fine. What are you talking about? So it actually varies dentist to dentist, and so our perceptions are equally important when we decide who is quote unquote difficult. There are lots of themes that we cover in this episode, like for example, patients who coerce you or bully you into doing treatment that you don't feel will work, patients who are rude, how to write a dismissal letter to these patients, and like what are the things that you should include in a letter like that. All the way to the end, if you listen all the way to the end, you will get VFan talking about those patients who are always trying to twist your arm for a discount and how to handle objections like that. The protrusive dental pearl I have for you is actually inspired by a conversation I had with V in this episode. This is something that was taught to me by Dr. Raj Ratan, who was my training program director during DF1. And he taught me never to say no to patients. Now, I know that sounds ridiculous because actually I'm saying we should say no to our patients, because if someone's being unreasonable or you're feeling bullied in treatment, or if it's not in the patient's best interest, then we should definitely be saying no. But what Raj meant by don't say no is, let's imagine a scenario where your patient wants to have some teeth straightening, maybe they want to have some aligner treatment, and you'd love to do that for them, but they're neglecting their perio, and because of that reason, they're not yet suitable for orthodontics. What you shouldn't say is, no, we can't do your orthodontics because X, Y, and Z. Patients just hearing the word and seeing you as you say no, it doesn't leave a nice image, and they remember that. So why don't we say it in a different way? Why don't we, instead of saying, no, you can't have orthodontics because X, Y, and Z, why don't you say, I would love to do your orthodontics for you. I think we'll get a great result. Your bite will be better. Your ability to clean your teeth will be better. I'm really looking forward to doing this to you. However, can you see, and then they show the photos, can you see that your gums are looking a bit red? I want you to be proud of this result. I want me to be proud. I want us both to be proud of the result we're going to get for you in the future. And so that we can get you a really nice result with the bells and whistles, we actually want your gums to be pink and healthy. So that we're ready to do this treatment for you, this is what we need to do first. We need to do some hygiene, we need to get you to do some incidental brushing, blah, 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 and then we're going to do your teeth straightening. How does that sound? Isn't there a much better way than to actually saying no? Now, what I have said to the patient is no, you can't have it yet because of your gums aren't quite there yet, but pitching it and phrasing it in a different way can be really powerful. I hope you enjoyed that, Pearl, and hey, if you did, can you do me a favor? If you listen on Apple Podcasts, then please do leave this show a rating, but a new thing now for my Spotify listeners, that if you're listening on Spotify, stop right now, go scroll up and give me a rating. I would really appreciate that, because Spotify ratings are a new thing and it really helped my show to get discovered. So if you give me a rating, I would really appreciate that on Spotify as well. Anyway, I'll stop blabbing and I'll catch you in the outro. VFan, welcome to the Protrusive Dental Podcast. How are you?
I'm good, thank you. Thank you so much for having me. It's really exciting to actually finally be on one of the podcasts. I've listened to them for quite a little while now, so thank you.
It's so great to connect with you all the way from Melbourne, and we've been exchanging emails, and it's been so great to have your listenership and your contribution now. So I love getting people on who listen to podcasts, because I find that people who actively find something and tune in something, they are connected in a way that you almost are like a self-selective bunch of people. And what I find is that we are the geekiest of the dentists, and this is a recurring theme. So I always love interviewing people who have actively listened to not just this podcast, but all the dental podcasts and stuff like that, because I think there's so much we can learn out there. So those people who don't know who you are, V, tell us about yourself, V. Where do you practice? What kind of interesting things which you told me about in the email that you've done, and what we're going to talk about today?
No, definitely. So my name's V. I'm from Melbourne. I actually did my university degree in Cairns, far north Queensland. So James Cook University. I graduated in 2016. I've actually had a private practice since then. So I sort of started running and managing my own practice since I graduated. Now we're a fairly big team. So there's about 6 dentists and a health therapist. We have 3 chairs running and we open 7 days. So fairly busy practice. And as you can imagine, post-COVID, everyone's coming in. But it's really interesting. It keeps me on my toes. And I do love it. But since then, I've actually got into a little bit of public sector work as well. As I was telling you, and what really got me into this podcast was I actually started listening to your podcast on the drive to the regional community clinics where I would teach 4th and 5th year dental students. So I drive up to Ballarat. It's an hour and a half. So your episodes actually worked really well. It's like about 52 minutes to an hour. And have my coffee, and definitely such interesting topics, and it's always sort of changing and hearing all the different speakers. So I do a bit of teaching out in Ballarat. I've also recently taken another teaching position. So I'm one of the senior dentists at the Royal Dental Hospital in Melbourne. And there's a dental teaching clinic in the dental hospital. So part of my role is sort of supporting the students, the supervisors and demonstrators out there, and trying to create a better environment for the teaching clinic. So it's really new to the role, and it's super interesting to be able to see, I suppose, the public and private facets of dentistry. As I told you as well, I did a bit of extra studies after I graduated. So I recently completed my Masters of Health Medical Law at Melbourne University. So
Amazing.
Thank you so much. It doesn't mean that I can qualify as a lawyer or have represent clients, but it means I have a special interest in medical legal, dental legal factors. I've got a bit of extra knowledge when it comes to that. I think it's quite helpful in both private and public. I was lucky enough to be the president of the Melbourne Law Masters Student Association when I was there, so that was a really great way to sort of interact with different students, part of the university, and currently I'm on the Australian Dental Association Oral Health Committee, and that's mainly about promoting oral health, which I'm passionate about. So I should say I do love dentistry, and I think for today as well, having done my medical law masters, it is interesting to see things from a patient perspective.
Well, I like to just extract the origin stories of people who come on, because some of the themes that we cover is so relevant to young dentists listening. So one thing I just want to just uncover a little bit more on all the lovely things you said there is, what inspired you to take your career trajectory, as someone who's running a busy practice now as well, to also, I mean, the teaching part I get, because I love that as well, but tell me about how you have now deviated a little bit towards the medical law side of things. What drew you to that aspect?
To be honest, if I hadn't done dentistry, I would have done law. So I'd always had the interest in, I'd always been interested for me, but in year 12, or, and that's when we sort of finished high school to go on to and do undergraduate studies, I actually got the privilege of working as a receptionist at a dental clinic. And I think that sort of took my interest out by being hands-on, and, I was assisting, and the dentist that I worked for, he was super passionate about it. He'd make a filling be like a really cool thing. He'd come in and be like, oh, that's the blue etch and the light cure. And, for me being, 17-year-old, I was super excited, and I thought, this is something I wanted to do. But I always wanted to do law. I loved reading. I found it really interesting. And so for me to be able to do something, and, when you've been a few years out and you do all these CPDs, you think, well, can I do something that, I'm really interested in, that's a bit different, that's a bit dentistry related, but not really. So I thought, I'll take the plunge and do the law masters. And I did think maybe at some point I'd want to be a lawyer, and maybe I would do the law masters and see, but definitely getting a taste of that. I don't think, I would end up doing a JD or a Bachelor of Laws, definitely not anytime soon. And I think I'm just kind of taking it back now and focusing on a bit of the public sector work too.
great. Well, I think any dentist who's thinking about the next step in their career, it's really good to have a level of self-awareness like you had. I think it's a great thing to have, but figuring out, who you are and what your interests are. And so you already knew about this potential law career that you could have had, but, you got swayed by your experiences. But now it doesn't mean that you can't have aspects of that in your own life. So I love that you've married those two together. And I think it's the message there for anyone listening is think back to before you applied dental school. You might have had other interests. How can you now bring that in to profession to keep that so that fire alive in a different interest that you can have, I think?
No, definitely. And we're so lucky with dentistry. There's a lot of flexibility with dentistry. Sometimes with the hours we have time to do part-time studies, and there's so much to dentistry. Like there's such an artistic, my associate dentists, some of them are super artistic, they're doing pottery and things they like. I have a friend who pursued an acting career while being a dentist, and we have, that ability sometimes. So I was really privileged to be able to do something like this medical law masters and be able to sort of marry it, like you said, with dentistry.
Well, today I'm so excited to talk to you about a really, really crucial topic. This is something that's going to probably get people's heartbeats racing when they start thinking and recalling about certain patient interactions, because it is about handling difficult patients. Now, if a regulator listens to this episode, I would like to say that all the themes covered in this podcast, all the scenarios are completely fictional, and this is for improving the profession and how we communicate with patients and how to get better rapport with patients. That's the purpose of this episode. So any likeness to any patients who may listen to this is completely fictional and coincidental. So I thought, in movies they have that. It's really important to have that
disclaimer,
disclaimer as well. So wow, what a big topic, right? So handling, firstly, this label, V. When I was emailing, I was reflecting afterwards, like, is it fair that we label these patients as difficult patients? Because essentially they're difficult in the perception of the dentist, because one dentist might find the patient very, very difficult, let's say in quotation marks, whereas someone else might get along with them really well. So really there's something else going on. So the first question I want to pose is, what are the challenges we face in terms of getting along with our patients in the view of especially the first 5 years? Because I can share you some stories, I'm sure you have as well. What are the big challenges young dentists face in terms of patient interactions and communications that makes us have this kind of conversation now about difficult patients?
Totally. I think one of the biggest things comes to building rapport, and one of the first key things is gaining trust. So I find that the difficult patients we encounter, they come in straight off the bat through the door. Oh, I hate the dentist, Oh, the last dentist I had, he tried to rip me off, or, oh, it gave me so much pain. I'm so scared of the dentist. I really don't want to be here. And it's hard as a young dentist. You might have had a long day yourself. Reception's just booked in this toothache patient. You're tired, you're fatigued, you might have had a complex case, and this patient walks in and tells you how much they hate you. And people don't realize how tough it is, for a young dentist to deal with. And they come in upset. Now, with these patients, what we have to think about is they've come in and most of them have had really bad experiences in the past. So there might be those patients that, they've been with an older dentist, or whatever they say may be exaggerated or may be completely true. So what's really difficult is to be able to turn this patient around, completely change their perceptions of dentistry, gain their trust, make them like you again, and then still deliver a good, clinical outcome. So it is really tricky. And I just want to say maybe, a little note or a tip in these cases is, if you really are trying to win these patients over, you definitely need to give them a completely different patient experience than what they've had before, and a unique patient experience. Because if you do, it really changes the perception and their outlook, and it's tricky to do. But these patients if they're genuine about, how awful their experiences are, it's just the little things. Now, not every young dentist may have this, or not many at all, but, our dental chair is pink and it has a massage in it. So it has a massage function. So a patient will come in and, they'll sit there and, for example, if they say, oh, I hate going to the dentist, and I'll just make a joke, keep it lighthearted. And I think with these patients, you really do need to do that. And I'll just say, oh, I bet the last dentist didn't have a pink chair with a massage function in it. And you don't need to have a massage chair, but whatever it is in the room or whatever it is that you're doing, and even scrub caps. find something that's a little bit different and just make it lighthearted, because you see their expressions, their tone change when you do it. And I know, and I love your podcast because you're always, there's a lot of jokes in them. And, with the way, if you're dealing that with patients, it's completely different. And I think with technology, what we have actually can make such a big difference. So something as simple as an intraoral camera, I
Big
take,
time.
and it's not, you don't have to get the whole kit and caboodle out, which you can, which is great. But if you're wanting something quick, intraoral camera, most chairs that have come with them now, take little photos, even just your x-rays that you put on the monitor in front of them. Some of these patients have never had a dentist go through and point out these things, and it's about interacting with them. I find the issues with gaining trust with patients is there's a breakdown in communication somewhere, and it's really easy to miscommunicate the patient if you're not interacting with them. If you're talking at them, then, you don't know how much they understand. You don't know how interested or how involved they are. And when you interact with them and you say, this is this cavity, what you really should say is you point to an intraoral photo and say, what is that to you? What do you see? And then they think about it. They're like, hold on, that's brown. That's, I think there's a cavity. I think there's a hole starting. And they own the problem. And it's no longer, oh, this dentist made me get 10 fillings. I don't know why. It's about, I need to go to the dentist because I have these areas this dentist showed me and I know what they are. So it's definitely making that experience. And it can be as simple as, showing them these things. But I think one of the things to gaining patient trust is patient education. There's breakdown in communication often when the patients don't trust you and they're not educated enough, because if they were, they wouldn't hate going to the dentist because they know how important it is. They would value the visits because they know it's like going to a doctor. I need this. And patients just, that wasn't, I suppose, that didn't come through to them. So I think gaining trust is really difficult, but there are definitely little things that we can do in order to help patients with that.
Trust is something that you gain in tiny little drops, but when
Yes.
you lose it in buckets. It's one of those things. So it's such a hard-earned thing that we have to do, and you're completely right. One of the key factors I found in practice is the intraoral camera, and I think it's just worth elaborating on that because a huge percentage, unfortunately, of the dentists who are even listening right now will just never get round to getting their hands on an intraoral camera. And just like you said, it's so widely available. So the one I usually recommend is it's on Amazon. It's like £150. So, Aussie $250 or whatever. It's so inexpensive. Every time I drill into caries, before I do, I'll always take a pre-op photo of that. As soon as I find the caries and find the brown ADJ, I'll take a photo of that. And then once I've done the cavity prep, and then I show the patients afterwards. And that is just amazing because you're right. You have that patient that says, oh, I don't think I needed 15 fillings. It's because the dentist never showed they're working out. So something that we spoke about in communication before is show you're working out. And I love that you say that. It's all about education.
Yeah, totally. And also show them the filling, take a photo of the filling afterwards. And I like to put side by side, or as you do the stages, so you do before and then maybe in between and then the final. And every filling, even though, they're adequate, they might not have the best anatomy, it looks so much better. And patients are pretty wowed by it. Most patients, and be able to see it and see, look, they actually went in and did the filling. Yes, they showed me that needs to be done. But yeah, patients really appreciate it. And sometimes they, don't know what they're seeing when it's all the way back there. So it is really valuable. And look, it might be difficult if your clinic doesn't have an intraoral camera, but like you said, you can buy USB ones, connect it in. It seems that if you don't have an intraoral camera, you probably have the digital, or a lot of, I think, even students I know have it, new grad dentists, so use that type of camera. And if, you really don't have access to anything, use a whiteboard, draw things out to patients, use a mirror, show them, and I have them point out where are the cavities, show me. You can interact that way, and also using your x-rays. So there are definitely ways to, educate patients.
And just like you said, it's about the co-diagnosis and getting them involved. You also mentioned about how when they internalize the values, and that's important. And you mentioned about doctors. Now, one reflection I had, and sometimes I like to give my guests some questions in advance. Now, this one's a bit of a curveball at you, I hope you don't mind.
Okay.
But this is a higher level. I was really reflecting, and I was thinking, if the times I struggle the most with patients, and thankfully it doesn't happen so much anymore, is lack of rapport and the fact that that patient's personality type is so different to mine. So, I mean, taking one step back even further,
Yeah.
I find that your patients become a reflection of you. So if you've been practicing enough in one place, the patients come, and the personality type of the patients that you attract and you retain are similar to you. So if you're an introvert, quiet dentist, you'll find that the quiet patients will come to you maybe. And then if you've got the crazy patients, like all my patients are crazy, mad, bonkers, positive energy kind of. And my nurses notice this. Like, hang on a minute, your patients are like this. So your patients are a reflection of you. So if you're getting poor quality patients, that could be something down to the way you communicate and the image you project. So it's important to be yourself and project your true self, because otherwise, if you're acting the whole time and you're not staying true to yourself, you'll end
Totally.
up being depressed, and then you'll find that you attract those patients. Now, when I find a patient who I just don't have that connection with, here's the dilemma now I'm going to throw at you, V, because when a cardiac surgeon has to see a patient, that patient may still be a difficult patient, but at the end of the day, they need this life-saving surgery, right?
Yeah.
And now you wouldn't have a cardiac surgeon saying, no, I don't like this patient because they're difficult. I'm not going to treat them. It just wouldn't happen. They need this life-saving thing, right? Whereas in dentistry, one of the themes I want to cover with you, V, is when do you think it's acceptable? And then also later on, we can cover about how do you tell the patient, like, what kind of stuff do you write in a letter to say that actually we've had a breakdown in relationship, we can't continue. But then, is it fair that we do this to our patients when actually it's healthcare? This is the higher level moral ground I'm covering here. So, any thoughts that you have on this?
Yeah, totally. Look, there are definitely cases where I think emergency cases, and when I say emergency cases, they've come in and they might not be the happiest patient, but if you can provide, that you can provide safe treatment. For example, they've got a facial swelling, right? Or let's say periodontal abscess. The tooth is not close to any, difficult, anatomical landmarks. You can safely take it out. The patient's, not the happiest, not your cup of tea. But I think in emergency situations, you should always try and do the treatment. Okay, if you can do it safely. If you know that they need it, but it is really close to a sinus or whatever it is, then you should still consider referring. Whether do they need antibiotics? Whenever you're not seeing the patient yourself or providing that treatment, you always need to make sure that they've got some referral pathway, and you're leaving out in the wind. So if there's a patient that has an emergency treatment, and let's say they're a difficult patient, so you're less likely to want to do a procedure where there's a higher risk, say, of OAC, right? I'll call the oral surgeon and say, look, I've got this patient so I show the patient that I care. I can't do this treatment for you. It is, I think that it's a high risk situation. I want the safest and best possible outcome. Since I can't do it for you, let me try my best to find someone who can. And they see me on the phone and I talk them through it and I say, look, he's really busy. Just give me a moment. And they sense that. And they think, wow, this must be really serious. It must be really difficult that she's going out of her way to call an oral surgeon. And I find that when you can see that you've done all these things, they're less likely to care that you didn't do it. If I can't get along to the private oral surgeon, sometimes I'll call the reg at the local hospital, max fax reg, and just say, hey, this patient's got a facial swelling. Or I just, I write them a referral. And sometimes in some cases, when I know how bothered they are about something and I couldn't give something to them, I just don't charge them the consult. And, you've come all this way. Usually I charge this fee, but, I'm sorry, I can't do this for you. And usually when they see that, they're like, look, she wasted her time too. Or and when sometimes patients do give you that, they say, look, I've come all this way, I've wasted my time. And I just nicely say, look, this is your x-ray. This is for you. You can take that. I'll email it to you. You've got a copy. And I know it seems like a waste of time, but I think you've come out of this knowing your issue, what you need to do. And I'm not going to charge you for the consult. And I've had patients who take a step back and they say, you know what, no, I'm sorry, you're right. I did get something out of this. Sometimes they sort of say things off the cuff. Now, in non-emergency situations, how you would deal with that is, you deal with the emergency, or they've come in and they're not in pain or whatsoever, then I feel like it's warranted to, do your checkup. They've come in for a checkup, or to do your checkup and clean. In most cases, I think something like that is fine. You come up with a comprehensive exam, and usually I sort of do like a multidisciplinary approach. So if it's a patient I don't think maybe necessarily suitable for me, there are specialists. So I give them options. Sometimes they're perio. I refer to different specialists. If I find there is a certain type of patient, and because I have such a big team as well, I know a lot of us, we're all sort of quirky, different personalities. And I think, look, this patient I think is going to gel better with my associate. They're going to get along. They've got, like, for example, Alex, my associate, he likes computer games or video games. And like those patients, sometimes it's hard for me to build rapport with them, And, I get the crazy cat ladies because, you might see two of my cats on screen later. And I totally know what you mean. There are patients you don't gel with, but you might know someone who gels with them. And then there are cases where you might not be able to spoon them off to someone. They might want to keep seeing you. Those patients that you think you don't actually gel with, they keep requesting you and they'll come. And sometimes it's a little bit awkward and
AKA
uncomfortable.
the heart sync patients.
You see the name in the books and you're like, but I think with those patients, I keep it simple. I don't do any complex work on them because I know, for example, even if it's endo or if it's I have to come back, for example, dentures, they're not a good denture patient, the ones that you look at, and they might not even like their treatment outcome. I keep it really simple. So I might see them every 6 months if they're not a patient that I feel like, they're not someone that's necessarily rude. They just don't, they're not your sort of cup of tea and your personal. And so, and I get sometimes the oral health therapist might do the clean or the hygienist will do the clean, and I'll come in bits and pieces. So you kind of work around that. Not everyone can necessarily be your cup of tea. And if you think about it, we meet these people, like you'll go to doctors, we'll go to maybe, a phone company, a shop, and you might speak to someone and they still, give you what you need. And they're not the best person or you didn't get along with them. But you can still give this patient whatever it is that they want if they want to keep coming back. But I think you should avoid doing the really complex treatment or the ones where you go home at night and you're going to really have that weight on your shoulders. And if they're completely unsuitable, like you said, generally there's, I feel, some sort of maybe inappropriate, whether they've been really rude or they've come in really late. I find it's often not just the fact that you don't sort of get along or they have a different personality, it's personality clash. I find usually
it's more, you're right, it's more than that.
Yeah, it's usually more than that, because I've had patients where you're right, the introvert, the quiet ones, and I can't have a real big chat with them, but they're nice patients. There's nothing wrong with them. They respect me, and that's why they keep coming back. But then there's patients that they still see you, but they're rude about it. They'll come in and and that's what makes it uncomfortable. Or they question your clinical judgment. There's something else there. And those types of patients, they're the trickiest one. But I find that the best way, if it really isn't something that you can treat them and there's something that's a little bit more like obvious, it is about writing that letter. You sometimes even have to offer and say, look, these are the local practices around your area. We really appreciate you putting that, in the letter, or whether you communicate it verbally and provide a written letter and say, we appreciate all the time spent here, but due to, breakdown in communication or, our differing sort of opinions and thoughts, and, I can't be the best person to provide the care. And I've heard of some dentists who just say that, if they missed a recall, whatever, they're just too busy now in their books and they just don't have a time to book it in. And that's a little bit awkward and uncomfortable because sometimes they book online. There's only so many things you can say no, and sometimes it's much easier to just say, look, and for me as well, since I do a lot of teaching and do a lot of things, sometimes I'll say to the patient, look, it's been great having you. I have a really big patient load, and I find that sometimes, I really appreciate you coming to see me, but when we communicate things, we're not on the same page, and, and it doesn't have to be because they disagreed with you or there was a big argument or whatever. I'm thinking that I'm struggling to communicate this with you, and I feel like I'm just, some things are just not sort of getting through as much. Whereas I reckon my associate or this dentist, he could probably explain things better than I can. And patients, tend not to take it. It isn't honestly, it's so awkward, Jazz. But
it's a mega
it's
awkward. But I think the approach that you've gone for, V, is I think you were alluding to the letter saying it's not you, it's me.
Yeah, totally. Or it's us. It's just we're not communicating well together. And I think sometimes, I just, even though they see it in writing, I mean, with some patients, if you tell them verbally as well and you document it in your notes and you say, look, and put it in, and then, I think legally, ideally, you probably should give them something. But I find, and that's honestly, I think that's a grey area. That's definitely not something that was touched on my medical law masters when it comes to really getting rid of, difficult patients, if there's not an actual legal matter. But in private in the private sector, we are privileged. We can pick and choose our patients in a sense. We are a business, and especially when it's not urgent emergency outcomes, we do have that ability to not see a patient as long as we're giving them the right referral processes and giving them the documentation so that they're aware of it, and giving them their notes. So yeah, I think at the end of the day, and also with the health fund, sometimes I would tell a patient, look, we're not preferred providers. How about trying, there's, other dentists that you'll save a bit more money at, and just sort of adding little bits and pieces in it. And I think, patients they get the idea.
Well, I think you going out of your way to suggest not just that, hey, we're not the best match for you, goodbye, but hey, we might not be the best match, but I think you can still get really good care that's appropriate for you from X, Y, and Z. There's a different feeling towards that, okay, although they can't help me, they've signposted me to places that can help me. So if you're going to be doing any kind of letter, and maybe we'll make like a template or something, but Vivi, I think that is so true that you shouldn't just say, we're not the best fit. You should be like, okay, we're not the best fit, but these places are available, because so you're not leaving them out in the lurch. But I like the way you answer this question, because firstly, I agree with all the points you made, and I like your risk-based approach, and I'm completely with you on that. That if and you're right, it's never just the fact that I didn't have I had a personality clash. It's more than that. They were also rude to my nurse, or they questioned my diagnosis, or they micromanage the way I'm going to treat them. So like I had a patient who there was a dentist shadowing me, and then the dentist comes, it takes a little step closer. I know we're in a pandemic and stuff, but still further, and everyone's got PPE on. It's like, don't come any closer, like like in a rude way, and that's not nice. And then when I diagnose caries and I communicate it, then they're like, okay, well I don't want LA, and I would like an amalgam, even though I haven't placed amalgam in 6 years. And this micromanaging and dictating me, that's where it's never just one thing. It was like 4 or 5 little things, and then henceforth, when I email you back saying, yes, this will make an amazing episode, because I'm going through this right now in my head, and these are tough things to face as a dentist. And add on to that, one thing that you kind of covered a little bit is that those dentists in the first 5 years, and V, you look so youthful and stuff. Like, my wife had this all. She still gets this, right? She still gets ID'd. She still gets ID'd for buying alcohol and stuff. Whereas I haven't been ID'd since I was 16 because of my facial hair. But like dentists, we're like, oh, hey, are you experienced enough? And when patients start doubting your expertise based on what you look like, that is another layer of a breakdown in trust. So, what advice would you give to dentists, young dentists particularly, or youthful looking dentists? These very lucky dentists who age so gracefully. What advice can you give them when a patient questions your level of experience based on your age and stuff?
It's difficult, and honestly, question I've had, and my practice is actually really young practice, and totally know what you mean. Look, I think for me, it's fairly easy because I do cosmetic injections, so I'll make a joke about that, and I'll be like, oh well, I do muscle relax injections, anti-wrinkle injections, fillers. Don't ask anymore. No, I'll make jokes about that, or I'll say something. Those really awkward, difficult ones, and they're judging you, and they're the same ones that say you're a girl, don't take a tooth out, like you're not strong enough. Those type of patients. They look at you and they're judging. And it can be, but I'll say things like, "Oh, it's rude to ask a woman her age." Like that's a bit rude.
Mm-hmm.
And sometimes
what a brilliant strategy! I love that.
I kind of I make a joke about it sometimes. I deflect, but it really depends on the type of patient you have. And some patients are a bit more serious, like the older patients. They're not going to appreciate a joke. And I'll say something like, it's a bit easier when you've had at least a few years, because you can sort of make it and be like, look, I've been out for a couple of years, or what I get my younger dentists say is, what, I'm a fairly fresh graduate, but I was lucky enough that I've actually come across these cases a fair bit, and especially the ones that a lot of us went to James Cook, and we saw a lot up there, and I'll say, look, trust me, there's stuff here that you never you wouldn't see up there. So there's lots of stuff that I've seen, that sort of thing. And then I guess they just reassure, because you might be young, you might be a fresh graduate, but clearly you have some experience in these areas. And if it really is to the point where there's patients that won't stop. They'll say, when did you graduate? And they won't leave, they won't leave you to it. And look, at that point, you can choose to be like, look, this patient, they just need to see a senior dentist. You need to refer them to someone more senior in the practice, because you can't, put up with this. You know that it's going to be hard, no matter how good your work is. It won't be as good as whoever looks older than you. But sometimes you can say things like, look, I only had, a couple of years, we did dentistry 5 years, but I did 3 years of practical experience, and I was one of the fortunate ones that managed to get a couple of hundred extractions during my time. So it's something I'm fairly comfortable with. And usually, and sometimes it's sad that sometimes you have to explain yourself, but you can do that. And sometimes, like I said, you can make a joke out of it. You sometimes can deflect it, and sometimes you can just refer them on to someone else. It's really tricky. And I have an associate dentist that literally still looks like he came out of high school. And sometimes when patients make jokes about how young he is, because we have a big sort of, photo of everyone in staff, I'll make a joke like, yeah, he's literally graduated high school yesterday. And they'll just laugh about it. And they'll think he's probably older than, he's clearly much older. So it's sometimes just a bit lighthearted. And patients come in when they question you, sometimes they're just a little bit agitated and anxious. And one funny thing I've had one time is with one of my dental assistants. I had a patient who said something like, you're a girl, you're not strong enough to take this tooth out. So I stood up. I may have been in a mood, Jazz, and I was like to the patient, well, Hugh, my dear, he's a guy. He's a pretty strong guy. I'll let him take the tooth out, and I'm just going to go grab a coffee. And then he was like,
I love that. I love that.
And Hugh, and he's a really funny assistant as well. He'll get on there and he'll he'll do it, and then we just all have a laugh about it. The patient's like, no, sorry, my bad. So
that is a fantastic story. I love how you did that. But what you also did is, and this will be very memorable, when you say something funny, people can remember this, and people can use these jokes. But what you've given us here is 3 or 4 tools. I wasn't expecting such a brilliant answer, but you've given tools that we can use. So it could be humor, it could be referral, it could be reassuring the patient, because sometimes the patient is just scared. They're just scared, and they just need that reassurance. And when you just say that one sentence, like, "Don't worry, I've done this loads of times before," and that's all they want to hear, and that's all. That's all it is. But then when the patient's being persistent, having the guts to stand up to them and refer them, or to ooze confidence. I mean, I speak to you now, V. I love the way you communicate. I think you're a fantastic communicator, and I think it's the confidence as well. It's just speaking with confidence, and patients love to see that, and they can smell it. So when you are anxious about that extraction, or when you are lacking experience and you're maybe not communicating confidently because you're not yet confident in that procedure or in that type of scenario yet, patients will sniff it, and maybe that's the point to either get some mentorship or refer that case, or just see the situation, be aware of the situation, and use that as a learning curve going forward, I think.
Totally. And you know what else, Jazz? It's great to be confident in saying you can do something, but be confident when you say you can't do something. So,
Yes.
and I have had, patients and, had students that have watched me observe, and I am fairly confident, and I've been lucky enough to be like that since, I think, only child things, since I graduated even. But I'm really confident when I say, this is a really tricky case. Look at that root, look at that sinus, look, I don't think we should really be doing this. I think it's a case for an oral surgeon. And when you confidently tell them how difficult it is, they'll also really take it on board. So they don't think, oh, she's not doing it today. She's saying no to me. I have to go to someone else. They think, oh, man, it must be really, really tricky. But if you're sitting there like umming and ahhing and saying, oh, we could give it a go. I'm not sure about this. Then they're like, is it really that difficult, or is it her, or,
Mm-hmm.
But if you really can't do it and you commit to it and you say, look, this is what you need and I might not be able to do it for you, or this is beyond what a general dentist should do, and you really say that to them, and a lot of them are like, no brainer. That sounds tricky. Yeah, of course I'll go.
It's communicating with conviction, just like you said. So whether you can do it or you can't do it, just be clear in your communication with conviction. Totally. Say it with confidence, and that is a great little pearl there as well. I love that. I've got so much to cover with you, V. This is going really well. I'm really enjoying our chat. Let's talk about the my way or the highway approach. So my background is that I'm at a stage now where I'm getting more selective about my patients. And it's going back to maybe 15 minutes ago, I mentioned that scenario about the cardiac surgeon. And ultimately, I just want to say to everyone, and this is not to, I guess, underappreciate dentistry in any way, but it's just teeth, guys. It's just teeth. Okay, it's just teeth. We're not dealing with heart surgery, thankfully, and this is why the risk-based approach that V said works. And remember that general dentists, I think most people listening are general dentists. We have the most difficult job in dentistry as general dentists, and let us appreciate that one of the best things about being a general dentist is being able to cherry pick. It's okay to cherry pick. If we didn't cherry pick, we'd go insane. So it's about knowing when to refer and when to treat and to remember that. But now I've come to a stage, V, where I'm very much like, not in all cases, like I give my patients the option stuff, and if they choose a reasonable option, then yeah, great, I'll do it. But if my patients start micromanaging me and making me feel uncomfortable in any way, I'm very much with that patient, listen, it's my way or the highway, and I'm happy to communicate that confidently. It took me some years to get to this stage, so I've had some struggles and stuff, and coming home and feeling like crap because of the communication struggles. We all go through that. But what do you think about this my way or the highway approach, and how can you do it in a way that's not going to land you a negative Google review or land you in trouble?
Yeah. Look, I definitely think there's a place for my way or the highway, exactly like you said, and I think the places where it is important is when you're being pressured or bullied into treatment, especially, young dentists, and especially when they're saying just things like, I want Invisalign and they've got gum disease, things like that. I just want straight teeth. I want white teeth, but they've got cavities everywhere. I think the my way or the highway approach is really appropriate when it's in the best interest of the patient. That it would be it would be risky. There'd be more sort of long-term
Inappropriate, risky, just not the.
Totally.
It would land you in legal issues.
Exactly. And one thing I just want to say is it doesn't matter if the patient signs on a piece of paper or you document patient warned that they've got gum disease, patient informed, patient persisted anyway, patient agrees, understands. It doesn't matter what they sign, what they write, and that they genuinely agreed at the time when they hand over the money. You are the professional. You're the clinical expert. You do that treatment. You're going to own it. And if something were to fail, it doesn't matter that they were warned. You're the professional with more knowledge, expertise, and you should have known better than to have done that. So it really doesn't matter. And even patients will say stuff like, oh, trust me, just put the crown on. It's been fine. And you know that there's pathology on it. And it might have not been painful. And they're like, just put on, like, I love you as a dentist, just go for it. But, down the track, if something were to happen, and they're definitely not your friend when they're in pain. No one's your friend when you've caused them pain. And I think it's a completely different situation. So I think
and patients very quickly forget, don't they, V, about the conversations that you had or what they signed. They very quickly forget when things go wrong.
Yes, they do. And honestly, even if they said, to be honest, like I know at the time, and it still doesn't matter because you should know better so I guess, so I think my way or the highway is really important. You have to stick to your guns when you know that it's the ethical thing to do, and I must say as well, though, there is a way of doing it, and sometimes it can be difficult not to, I guess, be a bit too harsh. It's about being firm, but I suppose not harsh or offensive. And it can be really difficult when they're arguing with you or you've been an hour explaining something. When you explain something for like half an hour, it is. And they come back and ask you the same question. So I can't do my Invisalign, and you've gone through all the gum disease and the bone and the bleeding. And it's really tricky. And I think, the best thing is always listen to them and don't, I suppose, speak for too long because they don't get the chance to, I suppose, ask questions or, it's too much information overload. So you're sort of addressing each key point. Have open body language when you do this, because let's say you're trying to tell a patient and you've got your arms crossed, it's a different situation. You're leaning away from them as opposed to towards them and open and involving them, and sometimes can make it a bit lighthearted. Like, oh, I really just don't want your teeth to fall out. That's all it is, or I take so much pride, and show the passion. I take so much pride in my work. I couldn't settle for treatment that I know is going to fail. Couldn't do that to you. Just couldn't do that to you,
I love that.
And you really just sort of emphasize, and you make it in a way that it's my way or the highway, in the sense that, it's for you. But I think one thing I really want to, I guess, emphasize is we can be all my way or the highway, but we can never, ever take away patient autonomy. So even if you know what's in the best interest of the patient, you still got to give them all the treatment options. They must make that decision. You don't make it at any point, and in most, pretty much every general dentist knows this. You don't make that decision for the patient. You should never do that. And I
But it's
think,
worth pointing out, V, for the young dentist, lack of experience, that okay, yes, we must discuss all the options, but it's all the appropriate options which are suitable, that
yes, yes,
would fulfill the patient's goals and would be clinically appropriate as well.
yes,
And so sometimes I find that patient comes in and they say, I don't want a denture, I definitely don't want a denture, and I need to do something right now. And then when I see the dentist letters, they say, well, your options are do nothing, a denture, and then they go the rest. Well, actually, no, they wouldn't be appropriate. But I guess
yes.
medical legally in the environment we're in, I see why they're mentioning it. But remember to keep it appropriate for that case for your patient.
Yes, definitely. Yeah, I think it was in one of your episodes as well. Like how many, like 78 ways or something to fill a tooth, or yeah, if you listed every possible thing, yeah, of course, it has to be clinically relevant. And if it was a medical legal case, if you're offering silly, sort of options or options that really aren't clinically appropriate, it's not great. You want your notes to be succinct, in that type of legal setting. So yeah, so totally, it has to be clinically appropriate. But I think with the My Way the Highway, it would be pretty, I suppose, inappropriately used if it was My Way the Highway because that's what I'm good at, and that's the only option that you're
Mm,
getting. So
mm,
let's say a patient, for example, would bring back to Invisalign. They don't offer fixed ortho, so every patient that comes through the door, Invisalign is the best thing for you. My Way the Highway, take it or leave it. That would be pretty clinically inappropriate. It would be, look, this is what I'm good at in my hands. That's my experience and clinical expertise. But it's worth getting a second opinion because I don't offer metal braces here. And having that conversation with them, whether they choose to take the second opinion or not. Sometimes I actually encourage them to, because
mm.
in a medical legal setting, for example, whatever it is, if you've referred a patient to a specialist or another, and they've come back to see you again, and you've gone ahead and done it, it's a little bit different than if they've gone ahead and it's failed because they are well aware, they've sought another opinion, and you said the best thing was, I always say ideal option, see an orthodontist. Next one, I can do this, is within my expertise, but get a second opinion. And then they come back to you anyway. And it's also that faith, that trust. So it is, I suppose, well-rounded in that sense. But definitely not My Way or the Highway because you don't know how to do another treatment option, or you don't want to, you don't like dentures, so that patient gets the bridge. But it's My Way or the Highway in the end. It's more of an ethical thing. It's what you're comfortable with. You don't want to be pressured, and you do it in a sensitive manner, in an open manner. And sometimes it's really hard to keep our cool. It can be, especially if you had a long day. But we do have to rise above it as professionals. We are expected not to, engage in arguments, unfortunately, and that's the job. You have to be patient about it, and you want to, but you just, that's something that you chat over a podcast or you call up a friend and you talk about. It's not something that you do in the day, and it's tricky. But yeah, I think that's the best way to approach it.
You mentioned those levels of consent, I guess, and it reminded me, like with the patient, if you only do Invisalign and then that's all you offer, I love that you highlight that. And we actually covered that in one episode, which I just remembered, and guys, you should listen to this because I spoke with Mandeep Goss, a specialist orthodontist, and he spoke about that exact scenario, V, about
Okay.
the 3 levels of consent. So if you only just offer Invisalign, that's like the worst level of consent. What he recommended was to say was that, okay, you can have Invisalign. Even if you don't do it, you should know about fixed braces and talk about that. And then maybe if there's a restorative option, be like, there is this restorative option, it can build up your teeth and stuff. Now, you don't tell them yet, ideally, that you don't do that yet, but you when the patient thinks, you know what, I quite like this idea, so great, I know
Yeah.
exactly the right person for you. That is a really good
Yeah.
way to do it. And just accepting the fact that you can't be everything to everyone. You have your little micro niche, but just
Yes.
because you have that niche doesn't mean that every patient, if all you see, if all you have is a hammer, everything looks like a nail, we definitely want to stay away from that type of
Yeah.
dentistry. And the other reflection I had as you were saying all those lovely things was in specific, when you're communicating with patients, we mentioned about having that difficult conversation about My Way or the Highway. And one thing I remembered is something that Raj Ratan, 7 or 8 years ago, he taught me, don't say no to patients, because patients remember you saying no. So when you said, V, to a patient that, okay, I want Invisalign, but then you're like, no, but the gums aren't healthy, and you actually do the same thing because you mentioned it, the better way to say it was like say, I would love to do this for you. Say, I would love to do Invisalign for you, but I want you to have lovely gums so that you get a fantastic result. I want you to have a brilliant result from this. So that we can do this, we need to go for XYZ process. So you're not saying, no, you can't have Invisalign. You're saying, I would love to do Invisalign once your gums are healthy. So it's a different way to do it. So patients perceive that in a different way, in a more positive light. And just like you said, in a sensitive manner. So I think all those little communication tips that we gain are so important. And that's when your communication really gets challenged, in those heated moments.
Yeah. And I haven't actually listened to that podcast yet, so I really need to. It's really good that you brought it up. Yeah, no, that's really good. But yeah, and even when I say things where it's a root canal or it's a difficult case that I can't do, or it's a tooth that I think needs an oral surgeon, I would love to do it. But it's in that tricky spot. And, you bring it back to the patient as well. I would love to, but, the gums and bones, it's all the foundations. Your gums and foundations of your teeth, and it's just like when you build a house, you need the foundations to be good. And yeah, so I think it's analogies as well, and sort of showing them like, I would love to do this for you, and putting the onus on them. It's not because we don't have
One
this.
thing I do,
Yeah.
just on that note, is the way I put the onus on a patient is when I'm showing the X-ray of their banana-shaped root, I'm very much emphasizing that your tooth is shaped like a
Yes.
banana, and
Yes.
your
Yes.
gums are like this. So that's my little technique to really make it like that. Your, and like my eyes go
Yeah.
like your. So
That would really
it
work
works, and
really well.
it works.
Yeah. And I say something like, "It's a shame that your root is right in the sinus." Like, I'll say things like,
Oh, how
so, and
unlucky!
yeah, how unfortunate. Like, it just happened to me. Yeah, and then patients get that, and you're like, "Oh," and they'll be like, "Do you see this very much?" Or, and sometimes, yeah, no, but it's helpful, and that's exactly right. You put the onus on them, and sometimes it's just that emphasis, just a bit of eye contact.
I have to say, like, the time there right now is like approaching 9 p.m. where you are, and I love your energy. I don't know how you're bouncing. You must have had so much coffee today. I love it. Well, you've answered the main questions, and I
Yeah.
guess I'm going to go back to the letter, because a big question I see on the dental forums all the time is like, okay, I've had a breakdown of relationship in the patient, and I need some sort of letter. So I was thinking that we're going to make a template letter just to help everyone out. They can maybe download or whatever. So you mentioned already about a few points in that letter and how to mention that it's not you, it's me, it's us, the breakdown of relationship in total, about offering alternatives. And I love that you mentioned that actually, okay, or it might not be me, but here are, I'm not going to leave you out in the lurch. Here are some places that you can go to, which I think would suit you really well. Or it might be an internal referral to your associate or whatever.
Yeah.
Any other tips that you think would make a really good letter?
I actually had to write fairly. It wasn't even a template. It was from a template, but it was a little bit tailored. And I think in some cases with these difficult ones, a one size fits all template may not work, but it could be sort of the structure that you follow. And then it does have to be tailored because every patient is particularly difficult. I remember this one, and I had my mentor help me actually, and I had a mentor that I've worked with, and he's actually 70. His name's Harry. He's awesome, and he'd help out one day a week. And he's also helping my new grads out now, so it's awesome. But I remember him writing something about yellow pages. Like, I don't know if you guys have. Have you heard of the yellow
Yeah, we
pages?
had yellow pages.
Yeah.
Yeah.
But it's like this old, like, I don't think, does anyone ever use the yellow pages? And I was like, Harry, that we can't put yellow pages, like, go look up the dentist in the yellow pages.
That's
It
so
was,
year 2000,
oh my
1990s.
gosh, so funny. I'm like, I don't remember, like, it's a big book. But, for us, we have like health engines. So there's like locals that they can look up and you say Google. I think tips would be, don't make it too long and don't make it emotional. Don't also talk about any specific clinical things, such as, and you should never do this in a Google review, by the way. If you're answering a negative Google review, don't say, but your tooth this, or you presented with this. That's clinical notes. That's,
Confidentiality breach, isn't it?
yes, yes, it's not something that's appropriate in these type
In
of
a
letters.
public forum. Yeah.
Yes, public forum, or even in this personal letter, I think keep it non-emotional, and don't have it too long, and keep it simple. So, dear such and such, and I think for those that don't present often, like they FTA a few times, so they don't make it to their appointment, they're a little bit easier. You can just say, you've missed this appointment, that appointment, due to the appointment schedulings, etc. We've had to unfortunately discharge you, or you can no longer have you present back to these appointments. We're more than happy to put you on a wait list for future reference. Otherwise, in the meantime, you can see such and such, or have a look, and thank you for, the visits you've had, or wish you all the best, that sort of thing. So that's possible. If they present at every appointment, for whatever reason, then you might have to allude to it. Say, thank you for, continued support of the years. Unfortunately, due to, a couple of maybe incidents of breakdown in communication, we've realised that we're unable to offer you the best care, and such that we think it's best that you discontinue the treatment here with us. So it's very simple, like a paragraph, if not. And we recommend that you visit these look for these sort of clinics, or go on these search engines. Sometimes what else I do is, you can refer to a specialist as well. In some cases where, you specialist management and you write them a referral to a specialist. And then you can even have that chat with the specialist beforehand and say, look, these are the issues. And, the specialist can sometimes chat to them. But it does make it a bit complex because they'll still come back to you for the checkup. And if that's something you really, really don't want to do, then you will have to discharge them. But I definitely think keep it simple, keep it non-emotional, don't put any clinical things, and don't have them read it. You shouldn't be something that makes them, I suppose, angry or upset when they read it. It just is plain and simple, just unable to continue the care with you, and thank you for, whoever support you provide us, and then you just sort of sign it and put it there, and just break down in communication, or we're unable to offer the complex treatment that you may require. And I think, keep it like that. I don't think there's a hard and fast rule. And
I think it's good that you mentioned to keep it concise and non-emotional, because the default thing to do is that as you're typing this, all your emotions, you're remembering those conversations, and that you definitely don't want to be in that state of mind. And so I think the antidote to that is to keep it as simple and as plain English as possible. So that's a great tip there, and I think we should all remember that. Hopefully, we're not going to be doing too many of these letters. It's the odd time, which is why I think you're right. To have an element of you could follow a structure and make sure you got a checklist so you don't forget to recommend other places and you don't forget these little things. Maybe a checklist would be more appropriate, but definitely definitely do make it tailored to that individual person.
I've heard of some practices sending it via registered post. Like, some patients pretending they didn't receive these letters and they just turn up. And, it gets really awkward because then you give it to them in person. But I think emails, you can do sent receipts so they've received it. Because sometimes patients will come back and say, look, I never got it. You didn't discharge me. I need you to do this for me now. So the fact that you've got send receipt, if it gets to that point, and then just documenting and putting your notes. Look, I've unfortunately had a patient that persisted beyond the letter, and it's unfortunate. And I had to record further, and, there was text, even SMSs they tried to send to the surgery. So I had to put that documented. I had emails screenshotted. It's sad, and it's hard when they persevere beyond that point. But I think just record everything, keep it concise, and if they're one of those patients that might say they didn't receive it, then just make sure you do it in a way where they've got read receipts or whatever it is.
I didn't even consider that, so that's a really good point. Now, I thought my question is, what if a patient was rude to your receptionist, to your nurse, or to you? Now, you said don't make it too specific, but how do you now put in a letter that, hey, you're rude, we don't want you because you're not, we don't accept rude behavior, but then without making them emotionally charged? Because the person who's rude, they never truly appreciate how rude they were, right? It's one of those things that, they might have been rude, but they're like, no, you guys were just unreasonable, or you guys are too sensitive about this, whatever. So do you think it's worth mentioning about the rudeness? It's a difficult one.
It's a difficult one. Sometimes it can be miscommunication or communication breakdown with the team. You can make it just broadly. We have a sign, and apparently, and this is also actually more from, hearing bits and pieces and what I was actually taught, but, you should have a sign that says, we don't tolerate verbal or physical aggression, whatever, verbal aggression.
Zero tolerance.
Zero tolerance policy, exactly. And you've got that on the wall, and, you can remove them off the premises. So you can verb it as verbal aggression. Or, whatever to the team members, or, the team members may have felt, uncomfortable, and sometimes those conversations with those patients, it might be easier, especially if they're rude to everyone but you just have a conversation with them verbally first. Because when you're the clinician and they're nice to you and not everyone else, they don't realize that that they're like this. And, and then you just say to them, hey, and they're usually super nice to you. So you say, hey, look, such and such, and I think, and you say something like, oh, I know the way you are sometimes, you might be off work, and we have a bit of a laugh, but the front desk, they might not know you as well as I do. So is it possible? And you have to have this conversation with them, and it requires quite a mature approach, but can you try and just be a bit more respectful or considerate, because it is a team environment, and I need them and to help me out, to fit your appointments in. We all need to work as a team, you and me and whoever. And I think it'd be really hard to get you in and book these appointments if we can't sort of work around with everyone. And when they're sort of a bit confronted with that, usually they'll probably be a bit more considerate, and they're less likely. Usually,
I love that.
I find that if they've used everyone else but you, it usually doesn't warrant necessarily a whole letter to kick them out. I think it just needs that one-on-one communication, and they're usually caught out because they don't realize that you know. And then and then I think they tone it back, especially if they really like you. So I actually have had conversations with the patients because and being a practice owner, I obviously love my team. I hate it when patients are rude to them because they're like my family too, and they're the ones that stick it out for you. So I have that conversation with the patient, and usually I think when they realize.
And that's the test. That conversation is a test. So how they respond to that conversation will make your decision very easy as to, okay, do they get the letter? Or, okay, they've got their wrist slapped and they're going to behave now. So that's really good. But I guess it also depends on the level of aggression that was shown to your staff. So, I mean, like sometimes it's so much that that, okay, it's not even worth having that conversation and they need that letter because it was so bad. But if it was like a small one, a bit of aggression, maybe they've had a bad day, but that actually in the chair they're usually quite nice and you want to give them a second chance to redeem themselves and then but to also get the message that, hey, you know what, you've done it once, but never again. So it's important to get that message. And I think you've explained that really well. V, you've answered my main questions. Thank you so much for wow. I mean, I really enjoyed our conversations. I think it's going to give a lot of value to young and experienced dentists about how to manage these awkward situations. Anything else you want to mention at all in terms of this theme of handling difficult patients?
Look, I think we went through most of it. One of the things I just want to suggest, I think maybe one of the things we didn't mention is it can be really difficult when maybe patients bring up financial issues. This is a younger dentist and a patient brings up and they say, look, but I can't afford that treatment. Or, can you make it a little bit cheaper for me? And then they start saying, I've got this young kid. And it's really, really sad. And I think that's a difficult one. It's still low SES areas. Not sure if you ever listened to face this, but I know my new grads have sometimes had that odd patient that comes in. And with those type of patients, what I would suggest saying is, never be judgmental at any point. Just listen to them and say, oh, look, until I understand it. And I say words like, it's an investment. I know all these feelings. It's a lot to take in. And yes, definitely it's a lot of money. I think in the long run, it's going to be investment. You're going to be able to eat and chew. And if we really think about it, it's going to cost you a lot more in the future if you don't do it now. However, I see where you're coming from. Your pros is different. I don't know what you're going through. And I'll offer alternatives. Like we can't compromise on our fees because they're reflective of, the materials we use, the time we put in, but how about this payment plan option? How about this private health insurance? How about we break this up a little bit? So we're only doing the worst ones. You're saving a bit of money here and there and really just working towards them. And I think when they see that you're trying, like you can't compromise on those fees and it's a good standard to have because once you discount once you say okay once, you set the precedent. So you just really shouldn't compromise on your fees, but you find little ways to show that you care and that you understand that they might not be able to afford the treatment. I think sometimes patients just need that. And also the ones that they wanted, just to get that extra amount of discount or whatever it is, they know, look, that's not going to work again. So I think that's probably another thing that I would add. Good. But apart from that, I think we covered a fair bit, and it was so interesting to chat with you about it, Jazz. So thank you for having me.
It was absolute pleasure, and I also respect the fact that just now, even when you answered that financial situation or explain that again, you followed that principle that I mentioned in Raj Rata. You didn't quite say no to the patient. You said, actually, we'd still love to help you, but how about these alternative ways that might suit you better? And that sentence you said about our fees are reflective of the materials we use. And our time, like everyone should internalize that. I love that saying because sometimes when you're presenting those scenarios, it's sometimes good to know a couple of canned phrases that you already got to sometimes give you that thinking time to give you your more tailored response. So that was fantastic. I love that. Where can we follow you on Instagram? And now that you got your medical law stuff in the background, do you have a website? Where can we connect with you?
Yeah, well, actually, I need to update photos on the website, but my practice is Sunshine Family Dental. So our Instagram, I think, is Sunshine Family Dental Clinic. And my Instagram is just VEEWHYP. So like a V whip, but it's like VYP. So that's my Instagram. But yeah, awesome just to see the practice. We try and put we try and post, a couple of posts a week, and each of the posts we have Instagram would be one about our staff, so personal one that's more like, about periodontal disease or have a picture of that or opening hours, and then little quotes. So yeah, so that's definitely where you can connect with me or the clinic.
Amazing. Thank you so much, V, for your time and for your conversations. I really enjoyed them and hope to catch you again one day.
Thank you so much, Jazz. And I'll keep listening to the podcast. Definitely have to listen to that one, the ortho one.
Well, there we have it, guys. How good was V's energy? I hope that this episode gave you some tools that you can use when you next encounter that quote-unquote difficult patient. This is the last episode of 2021, so I'm wishing you a very happy new year as we ring in 2022. I really appreciate your listenership, guys. Honestly, it means a lot to me. Hope you grow together during 2022. Hope you smash all our goals. And I look forward to learning together in 2022. If you wanted to give me a New Year's gift, for like a 2021 goodbye gift, then I would love for you to share this episode with a colleague who you think might find the themes of this episode very useful. Anyway, thank you so much once again.